Now we're going to add the stockinette. To properly apply the stockinette to the patient's extremity, you want to make sure we roll it up to be gentle on the patient to get it across the ankle area. Open it up wide enough so the foot can fit through, and just roll it up. To apply the dressings, go ahead and just roll the stockinette back. Get your dressings and cut it to the size of the ulceration that you need to make. Make sure when you apply some type of tape that is not super adhesive, I prefer the paper tape. When you're putting the tape around the toes or any type of dressing around the toes, don't enclose the toes or squeeze the toes. Again, making sure you don't squeeze the toes with the dressing. Now what we're going to do is go ahead and apply the 2x2s. It's going to cushion the bones, okay? Also is going to prevent maceration. We can also use one of our other products, which is Cutimed Sorbact, to go weave between the toes, a ribbon form. But for this purpose, we're going to go ahead and just use the 2x2s. Put them in each one of the toes, and go ahead and pull the stockinette back down, ensuring that your dressings have not curled up. Now the leftover stockinette that's hanging over, you're going to go ahead and roll that on top of the toes, ensuring that you don't hyperextend the toes. You can go ahead and put your finger there to allow just a little bit of space as you roll it up. It's very important that as we add the adhesive felt, which is going to protect the bony prominences on the tibial crest and also on the malleoli, that the patient is in a 90-degree angle or positioned in neutral position. Go ahead and peel off the adhesive felt. Do not take all of it off because it's going to be extra sticky. Determine your landmarks again, the tuberosity there. Again, make sure the patient's at 90 degrees or in neutral position. Use some of the adhesive felt to tack down the leftover stockinette. Cut the extra off. Ensure the patient's at 90 degrees. Remove any wrinkles that you may see. And go ahead and apply the malleoli pads. Ensure that the malleoli pads do not overlap, which can cause a pressure point. Apply on both sides. The adhesive felt is applied on the bony prominence, and we're complete with that. Next, we're going to apply the perforated foam as a toe box on the toes to allow just for more comfort and allow the toes to move just a little bit. Move the adhesive backing. Apply on the center of the toes. Go ahead and form that around the foot. And as you see, there's an impression there. When you get ready to go ahead and take all the excess off, because it's going to look like a little hammerhead, shark position I would call, you go ahead and start in the proximal portion to ensure you won't cut the toes in the process. Now we're going to go ahead and apply the padding to the patient's extremity. When you apply the padding, this is our Specialist 100, it's a low loft type of padding, meaning it's not extra puffy. It's going to allow you to tear it really easy to go around the extremity. We're going to apply the padding on the foam portion also to make it for an easy removal of the cast at the end of the procedure. This doesn't have to be extra smooth, but just cover the foam. The important part is to apply the padding on the extremity, 2 layers, but we're going to also make sure we put a little bit more on the bony prominences, the malleoli, and also the heel area. It comes with 2 rolls, so this should be sufficient enough to cover the extremity pretty good. Go ahead and apply the padding on the extremity. Make sure it's flush against the extremity. and that's 2 layers there. This is the way that can help you out instead of just go ahead and just rolling it up. You can take care of the bony problems by adding the stirrups and keep on top of the position of the patient. So that's 1, and this is 2. And because this tear is really easy, you can go ahead and get the extra in the back and pull that up in a contour to the patient's extremity. Now I'm going to take care of the posterior heel. One, 2, and the part that's hanging down, go ahead and pull that off. The remaining portion of the padding, we're going to just roll up the extremity. When we roll this up, our goal is to go 50-50. Every revolution going around, we cover up half the width of the padding. You notice what I'm doing is tearing it a little bit as the circumference of the extremity starts to widen. Our goal is to make sure that this has smooth transitions so there's no possible pressure points. What I did, I finished that up with 3 layers up here just to cushion the back of the leg pretty good. Now what you want to do is make sure that there's not any hanging wrinkles. You pull that extra off. Any areas where you feel like it's light or not enough padding, you go ahead and just piece any areas that you need to make sure you need to pad a little bit better. Again, things that you want to make sure of is making sure the patient's in the proper position. Now we completed the padding. Now what we're going to use is our Delta-like conformable tape, which is fiberglass. Ensure you have a pair of gloves on because you don't want any of the resin to get on your hand. And also make sure the water temperature is cool, tepid, or room temperature when you apply. The instructor is going to actually tell you which size you want to use first. I'm using a 3-inch because what we're going to do is go around the foot, at the bottom of the foot. In order to activate this properly, depending on your level of experience, you're going to just dip the roll in the water. If you want to make it set up a lot faster, go ahead and dip it in the water and hold it underwater and squeeze it 2 or 3 times. That will ensure that the water is thoroughly throughout the whole roll. So dipping the roll in the water, ensure that the water totally saturates the roll. Some people like to say until the bubbles cease. Now you can apply this on the medial or the lateral side when you first start. And again, we're going around the rim of the foot. You're not pulling it hard, just enough till it conforms around the patient's extremity. And our goal is to roll this around the rim of the foot twice. And as you notice, the roll is turned this way, not that way, as I apply it. And I'll demonstrate that later on. So as I go around the 3rd time, as I approach the 3rd time around, I go ahead and take care of the dorsal aspect of the foot and then the plantar aspect of the foot. As you notice, it's conforming to the patient's extremity. And then you start doing what we call 50-50 again, as like we performed with the padding. Ensure the patient's at 90 degrees just before you get ready to go above the ankle. Always end your roll on a wet portion of the roll and the same direction. Laminate, ensuring you push those layers together, which you just applied.